Tiny viruses, invisible to the naked eye, are lurking on surfaces, hiding in food, and waiting for the perfect moment to make us sick. They are silent invaders, ever present and ready to strike. Among these microscopic foes, Norovirus stands out as a particularly formidable opponent. It causes millions of cases of gastroenteritis, commonly known as the stomach flu, each year, leading to widespread discomfort and disruption. Though often dismissed as a minor inconvenience, norovirus can pose serious health risks. This is especially true for young children, the elderly, and those with weakened immune systems, who are more vulnerable to severe symptoms and complications. Understanding norovirus, its transmission, and how to prevent it is crucial for protecting ourselves and our communities from its unpleasant effects. Knowledge is our first line of defense against this pervasive threat. Norovirus is a highly contagious virus that spreads easily and rapidly. It often sweeps through schools, cruise ships, and communities with remarkable speed, leaving a trail of illness in its wake. Its ability to survive on surfaces and in food for extended periods makes it a persistent threat. Moreover, its resilience to common disinfectants makes it difficult to eliminate, requiring diligent and thorough cleaning practices. By understanding this unseen enemy, we can better protect ourselves and our loved ones. Norovirus, sometimes referred to as the winter vomiting bug due to its prevalence during colder months, is a type of virus belonging to the family Calliciviridae. These viruses are non-enveloped, meaning they lack an outer lipid membrane, a characteristic that contributes to their hardiness in the environment. There are many different strains of norovirus, and new strains emerge frequently. This constant evolution makes it challenging to develop long-lasting immunity, as previous infection with one strain does not necessarily protect against infection with another. This explains why people can experience multiple bouts of norovirus illness throughout their lives. The virus primarily infects the gastrointestinal tract, leading to inflammation of the stomach and intestines, which manifests as the unpleasant symptoms associated with norovirus infection. Norovirus is notorious for its exceptional contagiousness. This virus is a leading cause of gastroenteritis, causing inflammation of the stomach and intestines, leading to symptoms like vomiting, diarrhea, and stomach cramps. It spreads easily and rapidly through various routes, making it a challenge to contain. The virus can survive on surfaces for days, and only a few particles are needed to cause an infection. One of the primary modes of transmission is the fecal-oral route, which sounds unpleasant because it is. This route involves the virus being shed in the feces of an infected person and then entering the mouth of another person. This means that the virus is shed in the feces of infected individuals and can then be ingested by others through contaminated food, water, or surfaces. Contaminated food and water are common culprits, especially in places with poor sanitation. Imagine this. Someone with norovirus doesn't wash their hands thoroughly after using the restroom. They might think a quick rinse is enough, but it's not. They then touch a doorknob, a utensil, or prepare food, leaving behind microscopic traces of the virus. These traces are invisible to the naked eye but can be highly infectious. Another person touches the same surface, picks up the contaminated utensil, or consumes the contaminated food, unknowingly ingesting the virus. This is how quickly and easily the virus can spread in a community. Norovirus can also become airborne through vomit, further facilitating its spread. When an infected person vomits, tiny particles containing the virus can be released into the air. This means that even being near someone who vomits from norovirus infection can put you at risk of inhaling virus particles. It's crucial to maintain good hygiene and take preventive measures to protect yourself and others from this highly contagious virus. Norovirus infection typically manifests within 12 to 48 hours of exposure, though the incubation period can vary. This means that after coming into contact with the virus, symptoms can start to appear as quickly as half a day or take up to 2 days. The timing can depend on various factors, including the amount of virus one is exposed to and the individual's immune response. The hallmark symptoms of norovirus gastroenteritis are sudden in onset and include nausea, vomiting, and watery diarrhea. These symptoms can be quite severe and often come on very quickly, catching individuals off guard and making it difficult to carry on with daily activities. Unlike some other gastrointestinal illnesses, norovirus does not typically cause bloody diarrhea, which is a distinguishing feature. So, the presence of blood in the stool should prompt seeking medical attention to rule out other causes. This is crucial, as bloody diarrhea can indicate a more serious condition that requires different treatment. Accompanying these digestive woes are often debilitating abdominal cramps, which can be intense and persistent, making it hard to find a comfortable position. Headache, muscle aches, and a general feeling of malaise are also common. These symptoms contribute to the overall feeling of being unwell and can make it difficult to perform even simple tasks. A general feeling of malaise can leave individuals feeling drained and exhausted. Low-grade fever may also occur, though it is not always present. When it does occur, it can add to the discomfort and make the individual feel even more unwell. The severity of symptoms can range from mild to severe, with some people experiencing only minor discomfort while others may be bedridden. Most healthy individuals recover completely within 1 to 3 days, but the recovery period can feel much longer due to the intensity of the symptoms. However, the virus can cause dehydration, particularly in young children, older adults, and those with underlying health conditions. Staying hydrated is crucial during this time. These groups are at higher risk for complications and may require medical attention to ensure proper hydration and recovery. Diagnosing norovirus infection is typically based on clinical presentation, meaning the doctor will consider the patient's symptoms and their recent exposure history. In some cases, a stool sample may be tested to confirm the diagnosis, especially during outbreaks or when symptoms are severe. Unfortunately, there is no specific antiviral medication available to treat norovirus infection. Treatment primarily focuses on supportive care to alleviate symptoms and prevent dehydration. This includes drinking plenty of fluids, such as oral rehydration solutions or clear liquids, to replace fluids lost through vomiting and diarrhea. Rest is also essential for recovery, allowing the body to direct its energy towards fighting off the virus. Preventing norovirus infection hinges on breaking the chain of transmission. This requires a multi-pronged approach that involves personal hygiene, food safety practices, and environmental disinfection. Hand washing reigns supreme as the single most effective way to prevent the spread of norovirus. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after using the restroom, changing diapers, and before handling food. If soap and water are unavailable, use an alcohol-based hand sanitizer containing at least 60% alcohol. Scientists are actively researching norovirus to better understand its biology, develop effective vaccines, and improve treatment options. One area of focus is on developing vaccines that can provide long-lasting immunity against multiple norovirus strains. Another area of research is exploring new antiviral drugs that can target and inhibit norovirus replication. Additionally, researchers are investigating the use of probiotics and other gut-modifying therapies to enhance the body's natural defenses against norovirus infection. Understanding the factors that contribute to norovirus evolution and transmission is crucial for developing effective prevention and control strategies. By staying informed about the latest research and public health recommendations, we can all play a role in reducing the burden of this common and often debilitating illness.